I'm just doing my hand hygiene. Hi, my name is Tracy Apiakubi, and I'm a second-year medical student here at U of T, and I've been sent by Dr. Hu to come and take a health history from you. Would that be okay?
Yeah, I guess so.
So I'm just going to get started by asking for your first and last name.
Yeah, my name is Layla Hammond.
Okay, Layla Hammond. And how old are you, Layla?
I'm 28.
Hammond. Okay, and how can I refer to you throughout this interview?
You just call me Layla.
Okay, and do you have any preferred pronouns? I go by she, her.
Me too. I use she, her.
Okay, perfect. And Layla, just before we get started, I want to let you know that anything we discuss is confidential between us, and I will be sharing this with Dr. Hu. However, if there is a concern about your safety or the safety of others, I might have to break confidentiality. Is that okay?
Yeah, that makes sense.
Okay, perfect. And so just to get started, Layla, what brings you in?
Oh, I don't know. My arm just really hurts. Yeah, I don't know. I woke up this morning and it's like so sore. Like I can't even let it hang. It just really hurts.
Well, I'm really sorry to hear that, Layla. So where exactly is the pain?
In my shoulder. It just like I don't even know what happened. It's just so sore.
Okay. And which arm? Can you show me? Can you point to it?
Yeah, it's in here. Just like really in here. Just really painful.
Okay, so it looks like it's on your right shoulder, correct? Okay. And can you explain in your own words what the pain feels like?
Yeah, it's like a throbbing pain. I guess it kind of changes, but most of the time it's like a really throbbing pain.
Throbbing.
Yeah.
So it's a throbbing pain, and you said it started this morning?
Well, I guess now that you mention it, I guess the shoulder's been kind of giving me problems for a little while now, maybe like a few months, but I don't know if I slept on it wrong or what, but I woke up this morning and it was so bad.
I'm so sorry to hear that. Okay, so it's been going for a few months. You woke up and you noticed it, throbbing pain. Have you noticed if there's anything that makes it worse?
Well, I guess like, you know, anytime I like to go to my HIIT classes. So, you know, sometimes after a HIIT class, it hurts. But I always just thought it was like, you know, with exercise, you get sore afterwards. But I guess this one always hurts more than this one. But I thought like, you know, I'm building more muscle on that side or something like that.
Well, that would make sense, actually. Who knows? Hopefully we can find out for you. So definitely exercise makes it worse. And is there anything else that you've noticed?
Well, today it was like when I woke up. So I guess maybe like if I sleep on it wrong, you know, I'm like a painter. I really like to paint, and I find like I haven't really even been able to paint. And like when I try and hold my arm up for a while, like it gets sore, but then I haven't even tried today because it's been so bad. But like in the past few months, like I can't really paint for a while, and then otherwise it gets pretty sore.
I'm really sorry to hear that. I hope that we can help you so you can be painting again soon. Have you tried anything that makes it better?
Well, I've been taking Tylenol and it's not really working. I think one of my friends gave me I don't know, it was something.
Was it maybe naproxen?
I think that was it. Yeah, and I think that one helped, but I only took that once because I don't really know what that is. So yeah, I only took it once, and I think that one helped more than the Tylenol.
Okay, so on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever had, how much pain are you in right now?
Honestly, I think like a 7. It's really bad.
Okay, and when you took the naproxen, did it bring the pain down, like in terms of number? Do you know?
Oh, well, this was like a while ago. So like normally I'd say like the past few months it's gone between like a 3 and a 5, I'd say.
Yeah.
And I think when I took the naproxen, it almost went away, maybe to like a 2 or a 1.
Well, that's good to know that there's something that's helpful for you. And I just wanted to ask about other things in the area. Do you know if the pain just stays in your right shoulder or does it move around at all?
Well, when I really like use this a lot, it kind of goes into my back a little bit, like not like still my shoulder, but more on the back. Yeah.
And have you noticed any kind of other symptoms along with it?
I don't know. Like, what do you mean by that?
Oh, sorry. I guess I should be more specific. Have you noticed any kind of tingling in your fingers?
No tingling.
Okay. And have you noticed any loss of sensation? Like, did you stop feeling maybe in your fingers?
No.
Have you noticed any heat around the area?
Well, yeah, like that's like the thing is like with the pain, it's like it feels really like warm. Like it feels like hot in here. Yeah.
Okay. So thanks for sharing that with me. So now I just want to kind of move on to understand maybe how you're feeling about this shoulder pain. Are you worried about anything?
Well, I don't know. Like, listen, I'm a really bad Googler. So as soon as this was bad, I was Googling it, and then it said like it could be like cancer, or it said that it could be like infected, and I might lose my arm, and like I don't really know what I would do because, like, as I said, like I love painting and my job. I need to be able to type for my job. So I don't know. Like, I'm just really hoping it's not something really bad where, like, you know, or like, what if it's like even like arthritis? Like, my mom had arthritis, and like, you know, she's like pretty debilitated by that now. So I don't know what it could be, but like everything I look at looks pretty bad.
Well, I'm sorry to hear that, Layla. And I can understand how frustrating that must be. Like, there's so much information out there. I can't, of course, verify anything right now. We still have to go through everything with Doctor Who. But I really hope that we can come to some kind of, we can find out what's going on, and it can decrease your worry a bit.
Okay, because I just really hope I don't need surgery. Like, I don't really have time for that right now with my job and my kids. I just can't be going to surgery. So, yeah, I just can't do that.
I understand. So you already told me a little bit about your mom. So we're going to move on to the health history. We'll come back to your mom in just a little bit. But can you tell me about your health history? Are you diagnosed with anything?
No, I actually think I'm pretty healthy. You know, iron deficient sometimes.
Okay.
And so I take iron and stuff for that.
Okay.
Yeah.
No other past diagnoses? Like in the past, maybe you've had a diagnosis?
No.
Have you ever been hospitalized?
Well, you know, as I mentioned, my kids, so that was all normal with everything for that. But
Okay.
yeah, so for my two kids, and like that was all normal. And then I also had my appendix out when I was 12.
Okay, perfect. And are you currently taking any prescribed medication? I know you mentioned iron. Are you taking anything else?
Yeah. There's this one my doctor gave me. It's like I think it's like a statin or something.
Is
like
it a
that.
statin?
Yeah.
Okay.
Yeah. So I take that every day. It's a red one.
Okay.
And then something April.
Maybe is it a Ramipril or a Perindopril?
I think it's that
Is
one.
it Perindopril? Okay.
Yeah.
So it sounds like, Layla, these pills are for something specific. Do you know if your doctors ever mentioned hypertension?
Oh, yeah, he did say something like hypertension, but I thought he gave me that pills so that I wouldn't have hypertension.
Oh, okay, yeah. So the pill manages your hypertension, but while you're still on the pill, that means that, well, usually that's something that's taken if you do have high cholesterol, or sometimes it's taken to prevent some issues down the line. But we can have a look at that, and we can talk to Doctor Who about that. Okay. So we've talked about some of your medications. Is there anything else? You mentioned the Perindopril, the statin, iron.
Well, you know, I take vitamin D.
Okay, perfect.
I also take ashwagandha,
Okay.
and then I also like to take it's like a B complex. Like there's a bunch of just B ones. It's for like energy, to get energy.
Got it. Okay. Are you taking anything else that is over the counter?
Well, like I mentioned, like I take the Tylenol,
Yep.
and that's just like when my arm is really bad. And then I guess I took the whatever that was.
Yep.
Yeah, I took that once, but no, I try to not really take too many things.
Okay, that sounds good. And no other herbs? I think you mentioned ashwagandha.
Yes.
Any other herbal medic?
Like I was taking like St. John's wort, but then my doctor told me to not take that, and then I wasn't really sure. So I have it in my cabinet, but I don't really take it anymore.
Okay, that's fine. Okay. And just before I forget, do you have any allergies?
I'm allergic to penicillin.
Penicillin. Okay, noted. Okay, so that's good for your health history. And you did mention that your mother has arthritis. Do you know if there's anything else that's been diagnosed in your family?
Well, my mom, she's not really taking care of her health. So she has diabetes.
Okay.
And then, yes, the arthritis. And then my father, he has peripheral, like the arteries are blocked in his legs.
Yeah.
And he, I think, I don't know, they mentioned something with his heart, but I don't know what it is.
Okay. So it seems like there's some cardiac, like heart issues with your father.
I think so,
and then some type 2 diabetes with your mother and arthritis.
Yeah.
Okay. And do you have any siblings?
No.
No. And do you have any children? You mentioned you have 2 children.
Yes.
And do you know if they have any health conditions?
Oh, no, I'm so lucky. They're so healthy.
Okay, perfect. Thank you so much. And just talking about children, we're going to go into our next section, which is our social history.
Mm-hmm.
And so just to get started, this is something that we do ask everybody, but is there any substances that you're taking?
No, like I told you, I take the ashwagandha and I take those medications the doctor gave me, but that's it.
I guess I should be more specific. For instance, do you use alcohol at all?
Well, I hang out with my girlfriends every now and then, and I'll have a little something to drink with them. Yeah.
And can you tell me exactly maybe how much you'd be having a week?
Well, we probably meet up about twice a week when the kids are asleep and stuff. So maybe you'll have a couple glasses of wine with them a couple times a week. So yeah.
And so maybe on a given night, how many glasses would that be?
Maybe depends, if it's a Friday or Wednesday, but maybe 2 to 4 glasses of wine a couple times a week. But it's just that. So,
and a glass, do you know how big that would be?
Just a regular glass of wine, maybe if I had to guess, 200 milliliters.
Okay, that's perfect. Thank you so much. That's really helpful. Okay, and so what about cigarettes? Do you by any chance smoke cigarettes?
Oh no, that's not. I would never do that. No.
No. Okay. And what about marijuana? Do you by any chance use marijuana?
No. Maybe back when I was in college, a little bit, but no. Since I'm having kids, no.
And do you use any other type of recreational drugs?
Oh gosh, no.
No. Okay. So no barbiturates?
No.
No, and no stimulants?
No.
Okay, perfect. And just more about your social history. We can talk more about maybe your home life. And so where exactly do you live?
I live in Parkdale.
Okay. And is that in a house or a townhouse or an apartment?
I live in a townhouse.
Okay, perfect. And who do you live with?
Well, I live with my 2 kids and my husband.
Okay, thank you. And do you feel quite supported by your family?
Oh yeah, they're great. I couldn't ask for anything better.
Okay, wonderful. And you were talking about being concerned about work. Can I ask you what exactly you do for work?
Yeah, I kind of freelance here and there, mostly in graphic design and some copywriting and stuff like that. Yeah. And
do you enjoy what you do?
Yeah, I do. I think now with the way things are, it's a little bit slower, but I like it.
Okay. And do you feel that you are making enough income to support yourself?
Yes, yeah, we're doing okay.
Okay. So you wouldn't need to talk to a social worker at this time?
No, I don't think so.
Okay. Perfect. All right. And just in terms of activities of daily living, what does a normal day look for you in terms of exercise?
Depends on the day, but as I mentioned, I like do my HIIT classes, and so with the kids it's kind of tricky, but I probably go to these HIIT classes are an hour long, maybe twice a week, and then I'll try and do a yoga at some point.
Okay.
And then I'm trying to keep my kids active because I find they just do better. So we try and go on a walk as a family at least two times a week, I'd say as well. So
that's amazing. That sounds like an extremely active life. And what about your diet? So can you tell me about maybe how many meals you're eating and what does that look like?
Oh, honestly, it's so busy with the kids. So honestly, sometimes my meals are just kind of whatever they leave over on their plate. But, when I do my exercise, I try to always get a lot of protein because I heard that protein is good after exercise.
Yeah.
So, on the days I do my HIIT, I do some eggs and stuff for breakfast and stuff. And then I'll maybe have some toast and then for lunch. Again, like I'm just really trying to focus on the protein. So I'll have like some chicken and some rice. And then if I have time to like actually get some veg, sometimes I'll do like some like little peas on the side. But really most of the time lunch is like what the kids don't eat. And then dinner is just really it's like a normal dinner, you know? So I fit things in there.
Okay.
Yeah.
It sounds like there is, you know, a little bit of discontinuity with some of your meals. If you'd be interested, we could also get you to talk to a dietitian.
Yeah, I guess like, you know, I am trying to always like eat well. Like I think we do a good job, but I guess it wouldn't hurt to have some, I guess, yeah, I see what they have to say, I guess.
Yeah.
Like, is that covered though?
I can talk to Dr. Who and find out for you. I'm not completely sure at this point.
All right.
Thanks for asking that. So the last thing I'm going to do is just kind of ask you a bunch of yes or no questions. You can just answer yes or no. I'm just gonna ask you about like everything physically from your head to your toe, basically.
Okay.
Okay. So just starting with your head, do you have any headaches?
No.
No. Are you feeling dizzy at all?
No.
Have you noticed any changes in your vision?
No.
What about any changes in your hearing?
No.
Are you smelling any differently?
No.
No. What about your mouth? Does food taste the same?
Yeah.
Or it hasn't changed? Have you noticed any changes with your swallowing?
No.
No. Do you have any neck stiffness?
No.
No.
Well, I guess like, 'cause I like to paint, like sometimes if I'm like looking up, then my neck kind of hurts from that.
Okay, that's helpful.
Yeah.
Thank you.
And like, I guess like with that, like in the shoulder, sometimes it does kind of come up my neck. So it's mostly with painting and like looking up and stuff like that. My neck sometimes gets sore.
Okay, that's helpful. Thank you for that. And just moving down a bit more, what about chest pain? Do you notice any?
No.
Do you notice that you get palpitations at times?
No.
No. What about your breathing? Have you noticed any changes in your breathing?
No, pretty normal, I guess. Yeah.
Okay, so you never feel like you have to catch your breath, like maybe walking upstairs or anything?
No, just like I guess like normally, like if I'm really like exercising a lot or like running, then yeah.
Yeah. So have you noticed any changes in your bowel movements?
No. I guess like sometimes I get constipated and stuff like that, but that's like kind of normal. And then also, you know, but I think no, things are pretty much the same.
When you do have a look at your stool, do you notice if there's any blood in that when you have constipation?
No. Oh my gosh, that sounds so scary. No.
Okay, perfect. And what about your urination patterns? Has there been any change there?
Well, you know, since having the kids, it's a little bit different, but not recently.
No. Okay, perfect. And I just wanted to ask, I guess, more about your arms. Or like your shoulder. Have you noticed that you're weaker at all on either side?
I don't know. I don't know if I feel weaker. It's just that like I can't do as much with it because I guess I can't really tell if it's the pain or if it's actually weaker.
Okay, and we can find out about that like when we do some more physical examination. What about your legs? Have you noticed any change there?
No.
So your mobility with your legs is basically the same. And just the last thing is psychologically, have you noticed any changes?
Well, I guess I'm just getting really frustrated because, you know, I told you it got worse today, but it's been like a few months where this is really impacting my life. And so, I don't know, it's just like really frustrating. It's affecting my sleep. And so it's getting really annoying.
Yeah, I can understand. I'm really sorry about that. And I hope we find out what's going on for you. But maybe just to summarize, and you can tell me if I've missed anything, Layla. So you notice that you've been having pain in your right shoulder. It's been about a couple months, but you noticed that yesterday in particular, you slept on the shoulder and then you woke up and you've been having a throbbing pain there. And the pain is pretty bad right now. It's about a 7 out of 10. And you have tried things like naproxen, and you said naproxen's helpful, Tylenol not so much. And so right now you're trying to figure out what exactly we can do to help you out. So have I missed anything?
No, I guess that makes sense. I just want to know that we can get this fixed.
Of course. I hope we can get this fixed. And yeah, so I'll take all this information back to Dr. Who, and we'll come back and we'll talk about what we can do next.
Okay, great. Thanks so much for your time.
Thank you. Okay, so now we are out of character. So this is R and Tracy, 2MD, and Layla. So this is my friend, and she's a dietitian, and maybe one time we'll get her on the channel and she'll educate us about nutrition.
Maybe.
And dietetics.
Yeah, honestly, context is great. But yeah, thanks for having me.
Yeah, thanks for coming on. So I guess I wanted you to do like the wrap up, just because at the end of most of our like OSCEs or interviews, the standardized patients will give us like a rundown of how we did. So they'll explain to us like how we made them feel and all that. So you could even get back into character and like pretend to be an SP.
I'll get into character as an SP who just broke character from their patient.
This is really meta.
It's really meta. Also, I will say, guys, SPs have a very specific way of giving feedback. So I'm going to try and lock in on that. So, so Tracy, when you said, let's get you back to painting, that made me feel heard and it made me feel cared for. When you said that must be very difficult or something along those lines, you said something like that, or like that must be hard, as I was talking about how this is impacting my life, that made me feel understood. When you asked me if I needed a social worker, it made me feel confused because, you know, my priority at that time was the shoulder pain, and I felt like we maybe moved a little bit farther from that.
Yeah, that's fair.
When you were able to give me the information about the medications I was on based off of the clues I gave you, it made me feel like I was in really good hands.
I appreciate that. Okay, now she can break character again. But that's literally how they're going to give you your feedback. So you might not get it in the actual OSCE, but usually when you're doing your interviews with the SPs, that's exactly what she did a really good job. They always do like, you know, the whole it made me feel, and there's going to be like a long pause between it made me feel and how they're feeling. But yeah, that was a lot of fun, and thanks for watching. I'm hoping that you guys are going to go ahead and slay your OSCE. So again, if you have any questions, please leave them down in the comments below, and I hope to see you guys again another day. Bye!